Hi everyone, in today's video we are going to be talking more about why antipsychotics make you gain weight. This is something that I hear people complain about so much, myself included. It's something that I've had to deal with while being on antipsychotics too. And so I thought it would be helpful to talk more about why it happens and maybe a little bit more about what can be done to counteract it. So today we are going to be joined by Dr. Tracey Marks. Dr. Marks is a psychiatrist who practices out of Atlanta, Georgia, and she also has her own YouTube channel, Dr. Tracey Marks, which we will link to in the description below. So hello again, Dr. Marks. Thank you so much for being here again with us today. It's wonderful having you again on our channel.
Thanks for having me.
In today's video, we are going to be talking about why antipsychotics make you gain weight. So I guess just to start things off, could you explain what is happening biologically as a result of the medications that is leading to weight gain for people?
Yes, so weight gain, it's the bane of these medications' existence because they work, but oh my goodness, the side effects can make them intolerable and also then make people just not want to take them and just suffer. Mm-hmm. So it's not entirely clear what all the factors are that lead to the weight gain. However, some of the ones that we know about are other receptors being affected. And what I mean by that is the drugs that tend to be the most weight gaining have the most activity at the histamine receptors and the anticholinergic receptors. Now, all that means is that they're just the drugs are designed to block dopamine because with schizophrenia, you get too much dopamine production, causing alterations in your perception. Okay, so we design drugs to block these dopamine receptors, but that's not the only thing they do. We can't get them that specific, and they end up affecting other receptors on the cells. So histamine or antihistamines can cause weight gain, as well as the anticholinergic effects, which the anticholinergic is another kind of receptor on the cell. That's kind of the best way to think about that. The biggest weight gainers are clozapine, olanzapine, and then probably the next in line would be quetiapine, also called Seroquel. The olanzapine is brand name Zyprexa. All of those drugs are excellent. In fact, all the antipsychotics are great drugs, but they're very good drugs. In fact, clozapine actually is in its own category as being the best antipsychotic drug that we have. But because they are very antihistaminic, they are very sedating, which can be a good thing for someone, say, having trouble sleeping. But with that, you also get the weight gain. And so if we step aside from the receptor issue, what ends up happening with people is usually the weight gain comes from an increased appetite. So these drugs, those main three, but others can do it as well, cause you to gain weight by increasing your appetite and making it harder for you to feel satisfied. So I've had patients tell me they'll go to bed and their stomach is growling. So it's not just like, oh, just stop eating the cake, put the cake away, stop eating the cookies. It's like this drive to satisfy a hunger or a craving, and even after you eat it, it doesn't feel satisfied. You just got to have more. And I've had people tell me they wake up at 2:00 in the morning and they just have to have something to eat.
Mm-hmm. Right. So, yeah, you mentioned increased appetite. Are there other factors that these medications kind of initiate, like reduced motivation or that kind of thing that would encourage weight gain as well?
Sure. So, yeah, along with the increased appetite can come decreased activity because they can also be sedating or just make you feel, even if you don't feel sleepy, it can make you just feel we call it lethargic or just too tired to do anything. So even if you're not necessarily needing to take a nap, you're not motivated to exercise or even be active. So it's not like you just don't feel like going to the gym. You don't feel like doing anything. And some people can just feel like they're under this heavy weight that they can't move around, and that can be directly related to the sedating or the fatiguing side effects of some of these medications. Now, not all of them do that. So there are some that are more on the activating side of the fence, and those are the ones where the antihistamine and anticholinergic receptors are less affected. And one of the classic ones for that is Abilify. Aripiprazole is probably one of the least sedating and weight gaining, but it can go on the other side of the fence of making you feel agitated as a side effect. So here, you're not feeling too tired to exercise, but you might feel like you're coming out of your skin, you don't feel settled. And so that's going on the opposite end of the spectrum from too tired, like with Zyprexa, to now feeling too uptight and agitated. The traditional or first generation antipsychotic medications, like Haldol as an example, are also not very weight gaining. The difference, I know you didn't ask me this, but I just can't help myself. The difference between the atypicals and the typical antipsychotics, the typical antipsychotics or first generation, they're also called primarily targeted dopamine receptors, because with schizophrenia, you have too much dopamine. So you block it or dampen it down and reduce the amount of dopamine, and you have less of the psychotic experiences. But the downside is that you block dopamine in other parts of the brain that involve movement and things. And so people would develop stiffness or movement problems, dyskinesias, they're called, facial movements, things like that. So then came along, let's reformulate these things to see if we can reduce these movement problems. And with that, they added, so they added to the dopamine blockade, they added blocking certain serotonin receptors. And that combination of blocking certain serotonin receptors and dopamine receptors made a difference in having less of those muscular side effects and still treating psychosis. So that's where the second generation of antipsychotics came into effect. But with that change in the way they were making them came this increase in weight gain potential. The first, second generation antipsychotic was clozapine. And again, that's the best one we've ever made. But it has a ton of side effects, was very good, but you can get a ton of weight gain with it, as opposed to something like Haldol, which was one of the first generation. But with that, you can get a lot of stiffness. You can look like you have Parkinson's disorder, whereas the clozapine, you don't have that problem.
I think I was always under the impression that the first generation antipsychotics came with a lot more side effects. And so I just assumed that weight gain was a part of that. But I guess that makes sense what you're explaining now about the serotonin being an added component of the second generation, which is leading to more of the weight gain as a side effect.
I do want to clarify, there are some first generation antipsychotics that do cause weight gain, but they tend to have more sedation associated with them because of the antihistaminic activity. So Thorazine is a good example. It would often be used in the hospital to calm someone down. And so I think a general rule of thumb is the more sedating a medication is, there's a greater chance of it also causing weight gain through the receptors.
Right. So I don't know if you mentioned it, but is there also something going on with like metabolism? Is metabolism being slowed down by these or affected at all by these antipsychotic medications?
So I'm not sure if that's a real mechanism as far as slowing your metabolism in the way that we think of metabolism, of like how fast you burn calories. It's really complicated and complex as to like what exactly is happening beyond increasing your appetite, There are certain drugs like steroids, for example, where you can pack on weight and it doesn't even matter. You could not eat anything and still gain weight and just kind of blow up.
Right.
And so, there may be some part of the weight gain that you just can't change, even if you were reducing your food intake and things. But certainly, the way to go with trying to minimize the effect of weight gain would be trying to use some of the medications that cause less weight gain to begin with. However, on this issue of changing your metabolism, I do think there are changes that can cause a metabolic syndrome, which is different from metabolism. So I just wanted to bring that up because those sound similar, but
Right.
these drugs can change your and cause a metabolic syndrome, which is the increased weight, but increased blood pressure, increased triglycerides, which would be measured by blood testing. That's not something you're just going to be able to pick up on. You can be overweight and still have normal triglyceride levels. So that would be something that you would check with your doctor when you get your normal blood work.
Right. So you did mention some medications that induce more weight gain than others, but does it vary from person to person as well? Or how does medication react with different people's genetics or brain chemistry? Is there differences with each person?
There are differences with each person. So it's not a given that the medications that are more likely to cause weight gain are going to cause a lot of weight gain for you. So, when these drugs first came out and they were doing the marketing for them, even the ones that were supposed to cause a lot of weight gain, like Zyprexa and quetiapine, Seroquel, the drug manufacturers would still say 2 kilograms, which is about 5 pounds. Well, I guess, 5 pounds could be a lot of weight for someone who's really thin, but in general, 5 pounds isn't a ton of weight. At least I wouldn't call it a ton of weight. But especially when I've seen people gain 100 pounds with Zyprexa.
Right.
So one person can take Zyprexa and gain 10 pounds or 5, I guess, from, the people they saw in their clinical trials, and someone else gained 70 pounds. Those differences could be the difference in just baseline metabolism of the person, how prone are you to gain weight anyway, your body habitus, your gut. I mean, gut health makes a big difference in your proneness to be heavy versus not heavy. We know that with gut health and gut research that we're not doing this, but if you implant or take feces from a thin person and put it into a person who is clinically obese, that person can lose weight, and vice versa. You take, someone can gain a lot of weight if they get feces from someone who's heavy. So those are lots of nuances that can make the difference in your likelihood of gaining weight from these medications that we know can make you gain weight. So, it really does depend on the person, your genetics, lots of different factors.
Right. So I guess, weight gain is such kind of almost a universal issue for people who are on antipsychotics. I anecdotally know of so many people who have struggled with this as a side effect, myself included. And so I guess I just want to ask, what is your best advice for helping people reduce weight as a result of antipsychotics?
Sure. My best advice, aside from trying to optimize the medication or the drug choice to be one that you're less likely to gain weight. I mean, some people can't help it, and the only thing they respond to is Zyprexa or olanzapine. So if that's the only medication you can take, okay. So from that point, it's hitting a clean diet hard. What are some of the clean diets? Mediterranean diet. The ketogenic diet is a diet that's been studied as a potential treatment for schizophrenia because of the high fat content and that being beneficial to improving the health and growth and proliferation of nerves in certain parts of the brain. Some people may not consider that a clean diet, but it is a specific kind of diet. It's hard for any of us, living in this fast-paced world where, cooking food and all that is inconvenient. So it's just much more convenient to get non-healthy food or not processed food and that kind of thing. So I get it that it's just easy. Yeah, it's easy for me to say, watch your weight. But if you're going to take one of these medications that has potential for these changes, I say that it really becomes super important to commit to trying to be as strict with the kind of food that you're eating as possible. Even if you chose, say, to eat more of a Mediterranean style of diet, I think reducing carbs, even if you don't want to do ketogenic, reducing carbs is still one of the probably the best approaches, or the easier approach to directly reduce your calorie intake and reduce how much of your calorie intake is being converted to fat. High carb diets lead to insulin resistance, which is already a problem that can develop with schizophrenia and these antipsychotic medication usage. So, knowing what the endpoint can be, which is weight gain, but also metabolic syndrome with the blood pressure and the glucose insulin insensitivity issue, then you want to start out by trying to either slow that process or prevent that process from happening by reducing your carb intake so that you don't accelerate this process of developing insulin resistance. So, it really does boil down to trying to make diet changes, really strict diet changes, and then, of course, increasing exercise. So there's nothing magical or, earth-shattering that I'm saying here, as far as diet. But I guess the key is that trying to get ahead of potential changes that can happen with glucose and weight, even if you're not experiencing that at the moment, you want to stave that off by reducing your carbs and really being serious and committed to your diet.
Right. So diet being a really, really important part of managing weight on antipsychotics.
Yes.
All right. Well, thank you so much, Dr. Marks, for sharing your knowledge and expertise about weight gain as it pertains to antipsychotics. I know it's something that, again, a lot of people struggle with. And so it's really nice to just hear a little bit more about what's causing it, what's going on, and maybe some things that can be done to mitigate it a little bit. So thank you.
You're welcome. Thanks for having me.
All right. Thank you. Take care. So thank you so much again to Dr. Tracey Marks for being here to talk about weight gain on antipsychotics with us today. I learned a lot and I really appreciated her sharing her knowledge and expertise. Also, make sure to check out Dr. Tracey Marks' YouTube channel where she shares so much information about mental health and psychiatry. It's really, really great and I always learn lots from her channel. Also, just a quick reminder that if you would like to help support us in creating content like this, please make sure to check out the link to our Patreon page where you can support us there. Through Patreon, you also gain access to our online peer support community where we offer various types of peer support, including weekly facilitated peer support groups. So if that is something that interests you, or if you just want to help support us in creating this type of content, please make sure to check out the link to our Patreon page in the description below. Thank you so much again for watching, and as always, wishing you and your loved ones good health. We'll see you in the next video. Bye.